Welcome back to Play to Win. The big game is upon us, and you know we have to talk injuries. They're a part of the game.
Yep.
Dr. A, talk to me about the Philadelphia Eagles and what it looks like for them.
Well, you know, everyone's going to try to play in the Super Bowl,
Yes,
right? Regardless of what
absolutely.
injury happens. So let's get started because the Eagles have some injury concerns to deal with. Let's get started with Alshon Jeffrey. No current injury concerns, but minor injuries of the foot, ankle, groin, and shoulders this year, all soft tissue and grade 1 injuries. But he's had multiple injuries in the past, and that's why he is at elevated injury risk at 23%. Jay Ajayi,
He's playing.
no current injuries, but chronic right knee injury is a concern. It's always been a concern with him ever since he was drafted in 2011. But if you look at it, above average at 68% and almost normal injury risk at 16%.
He's playing.
Zach Ertz, no current injury concerns. However, concussion in week 13 and hamstring in week 9, and the exact same thing the year before. But he is playing, and he's almost close to low injury risk, and he's above average HPF. And Nick Foles, low injury risk and above average. Only a rib injury, but no fractures, and he should be good to go for the game.
Yeah, there wouldn't be much of a game if any of those guys miss. Dr. E, the one guy that everybody's talking about on the other side, Gronkowski.
Gronkowski, should he play or not? As you guys know, he sustained a concussion. And we know that he actually was taken out of the game. And the reports have said that he actually lost consciousness. So we know that it is at least a grade 2, possibly 3. So we know that sometimes takes almost close to 3 to 4 weeks to get back. So I don't recommend that he's going to be playing. But you know, he's like you said, he's going to play.
Listen, I just can't see with the Patriots having 2 weeks off, with him having missed already a half a game, I don't envision any possibility where Gronkowski
Gronk's priority, number 1 is playing the Super Bowl. Number 2 is to deal with the concussion results after the game.
However,
right?
we do have some images showing that what happens if you do play, right? MRI, repeated concussions. You can see on the right side, you can see. That's what a brain looks like.
Yep.
You also have images that actually show, when you look at the electrical pulse of the brain, the black area in the front of the brain, that's someone who sustained multiple concussions.
Okay.
There are
Clearly.
long-term effects.
So we know that.
Right.
Gronkowski's playing, guys. When we come back, Jeffrey the Edge Schechter talks Super Bowl wagering. Stay with us.